on video and uploaded to YouTube for transparency. John Prashar tells me he's waiting to be let back in, Sheridan, so I'd appreciate it if you would, or somebody could just get in touch with John and try and help him, because he's not shown us in the lobby for me here. So he may be trying to link to another call, which sometimes that happens, and I've made that mistake myself.
I will do.
So thanks very much, Sheridan, that's great. Okay. Right, I think we're ready to go then. So we'll make a start. The meeting is being recorded. I'll just ask people to mute. I can tell I've got an echo. Altaf, I think that may be in your device, so that's fine. That's okay. So as long as people can hear me, that's okay. Okay, well, good afternoon, everyone. Welcome to our Council of Governors meeting. This is the open meeting. We would normally, of course, wish to have this in public, with the public able to attend, but in its place, we are recording this meeting and we will publish on YouTube. So that's the intentions. We should note that we are in the PERDA pre-election period. So the election's been on the 6th of May. Now, I don't believe as chairman that there are any decisions we are taking today that ought therefore not to be made. And so I'm intending to proceed with all the matters on the agenda, but I am alive to that fact, and if it arises, then I'd be grateful for it to be brought to my attention, or indeed I'll consider that. So that's where we are with that. You can see, Governor colleagues, we've got a kind of significant number of matters to get through on the agenda. Some of those are a little bit transactional, and I hope we may be able to deal with fairly quickly. And there are lots of opportunities at the early part of our meeting to hear from our exec colleagues some detail that have been asked for in particular. And so it's also encouraging, I think, as chairman, to see the influence of Laura's presence on this agenda, that we're really starting to pick up on a lot of the things we've been wanting to tidy up for a while. So well done, Laura and team, and thank you for bringing these matters to Council of Governors. I do want to start by thanking Governor colleagues who were able to join me for the informal quarterly meeting with myself as chairman. Really productive, great discussion. And as promised, I collated a list of those issues that required a little more detail from exec colleagues and passed that to Mel. And I'm assured that all those matters will be covered by Mel or exec colleagues during the course of the Chief Executive's report or elsewhere within the agenda. So that's where we are with that. We do have apologies. So again, I want to thank, we've got apologies from Selina, from the non-exec body of directors, and only from Paul, from the exec directors. So it really, again, represents a very strong attendance at this Council of Governors, and I'm grateful for that. I should just make sure that I'm not missing anybody. I don't think anybody's going to come in and tell me that somebody else is not here that should be. So we have the entire board of directors, other than one non-exec director and one exec director, Paul, both who've given their apologies. We've received apologies, governor apologies, from Kavita and Ruth, and I don't think there are any other governor apologies submitted. And in the absence of me being told otherwise, I'll assume that's the case. Okay. We will, so we'll try and get through everything as best we can, excuse me. And I'll just check whether, looking at the agenda items, so I won't read every one, but you can see what those agenda items there are. Are there any declarations of interest that need to be made, please? Clearly, I and the Neds have an interest in items 15 and 16, but given that they are process issues and don't relate to individuals, I'm going to suggest that we can happily proceed with those items, noting there may be a conflict, and but proceed with everybody present. So again, if it comes to it and there's a need to change that when we get there, that's fine, we can do that. Okay. I'm going to ask if colleagues have had the chance to check the minutes of the meeting held on 21st of January. And if there are any matters of inaccuracy or amendments that are requested, please do use the hands up facility or come in if you need to. But I see that there's no notes there. And Laura, I think you did receive some correspondence from Governor Amit, didn't you?
That's right, Max. Sorry, there's just an echo.
Okay. It's not coming through for me as an echo, Laura, so
all right.
It may just be yourself.
Yeah, I think it's okay now. Yeah, sorry. So Amit proposed some significant amendments. This was in relation to his comments under item 5 on the minutes. So this has been reviewed and I'm proposing that the minutes as they are written include sufficient detail to cover that item. So we haven't made any amendments, but we will keep those comments on file. So just wanted to make governors aware of that.
So you provided some significant additional detail to some points that you don't believe add anything to the actual record of the meeting. So thank you.
That's right.
And in the absence of anybody else telling me that there's anything missing or needs amendment, I will propose that we accept those as a true record of the meeting on 21st of January. Thanks, everybody. And there are 6, I'll just let Alistair in. There are 6 actions arising from that. Again, I hope colleagues have had the chance to look at that. 4 are shown as closed. I suggest a 5th should be, but 4 are shown as closed. Before I move from this, I'll make sure that people are content with the fact they're closed, and 2 remain open. The 2 remaining open are the 2nd and 4th on the list. The 2nd relates to a matter in my opening remarks, which was advice regarding governor attendance at committee meetings, and that we, as a trust, think about how our academies might involve governors in academy business. I believe that, well, I'm satisfied that the 2nd aspect of that will be dealt with at item 8. I've spoken with Laura prior to this meeting, so we will consider that. And I think we did circulate the guidance from NHS providers as well, Laura, didn't we? Yeah,
we did.
So
yeah.
Again, unless there's any objections, I assure you that the 2nd part of that will be dealt with at item 8, and I propose that we can close that action. And at the 4th action down, number 11, it was just a simple process, a simple issue regarding the chair appraisal process. And it was that the paper should be updated to remove the reference to circulating the chair's objectives to the entire council, and that they would be circulated to the governors and RC only. And Jackie, I think, can you confirm that that's been done?
Yes, that has been done, Mark.
Yeah, that's been done. Okay. I'm going to propose that there's nothing outstanding from the actions arising, and that we accept those as dealt with and closed, and we note that item 8 will have some further detail today. Colleagues, particularly exec colleagues, item 5 is the fact that there's a very useful pre-meeting with non-exec directors that takes place prior to this and runs for an hour or so. And so I can report as chairman that that has taken place with the attendance that you can see today, with the exception of Hardem and Stella, were the people present. Very productive discussions. We tend to run through our academy business areas, and the non-exec directors will talk about strengths and weaknesses in those particular areas, challenges and things that we feel are going well. And so they've been conducted in respect of the work around people, performance and finance, quality, and then Barry brought to our attention just some key points regarding audit. Just bring to your attention of interest a couple of points that were raised by governors. There was a debate over the annual capital rules and the need to spend before the end of March, and a kind of agreement that that doesn't always lead to the most efficient decision making, but I'm afraid we're sort of stuck with that. Good point was raised by a governor about Actors 1, terrific project, terrific idea, terrific ethos and way of working, but it would be useful to have good visible examples of how we as a trust contribute to that agenda. And so what are the actual examples that might offer benefits to patients of how we work there? So we note that. There were also good issues raised by governors about research And I think generally, if it's fair to summarise, governors thought it was good to see research being brought to board and a direct line to Quality Academy. So Ray, your previous paper to board was noted and discussed as in relation to its impact on the Quality Academy. But there was a good challenge as to how do we apply it. And actually, I won't name governors, it's not fair to do that, but it was a good point that I've actually heard Mel herself say previously that, well, okay, it's great doing all this data analysis, research, etc. But how are we applying it and how we're learning from it? And the non-exec directors dealt with that. But I share that for the whole council in the spirit of trying to promote that and the good research that we're doing. Also, of course, that research and Actors 1 come together well, and that there's a good link between the research work we're doing and how we would work across system partners. Finally, there was Laura, an action should be raised for this, please, that governors in their initial meeting had noted that it wasn't always clear to them how they should properly raise issues with the trust that might have been raised by constituents with them. And so there was a feeling that some guidance and support might just help in helping governors fulfil the duties to constituents when matters were raised with them. That led, of course, to other issues of, and do we ever kind of collate the themes and patterns that might be arising in that? And also a very good point that if a governor raises an issue, it ought not to be an individual challenge for that governor, but it's a collective matter for the Council of Governors. So we felt that that was worthy of a session amongst governance staff, Laura, under your command, and that governors, perhaps one or two governors would decide on that, ought to be invited to that discussion. So if we could raise that action, please, to convene a session, and Laura, I'll leave it with you as to determine who you might invite, what the nature of the discussion might be, but it's about trying to give some clarity to governors and make it a council issue. Yeah, is that okay, Laura? Yeah.
Yeah, that's fine. Thank you. Yeah.
Thank you. Thanks. So we'll capture that as an action, and that's the so that's kind of my brief summary of the pre-meeting with non-exec directors. Okay. In the absence of anything further that needs to be said there, David, I'll bring you in. Yeah.
Yeah. Thanks, Max. And we also mentioned in that session with the NEDs, maybe having a regular item in the Open Council of Governors meeting, where those issues that we've picked up and can be raised, and we can have that discussion in public. Obviously, taking any details out of patients involved.
Thank you, David. Yeah, that's noted. I do realise that. I was going to avoid going into detail about the things until the session. But you're absolutely right. That was felt to be something that should be considered. So that's okay.
Yeah, fine. Thank you.
Yeah. Thank you, David. Yeah. So then Tariq has just come out, but it's come back in now. That's fine. Okay. And on to the rest of the agenda items proper. Item 6, there is my chairman's report. Hopefully colleagues have had the chance to read that and you've been asked to note the report. But I'll just bring to your attention a couple of things from that. I think directors are all aware, and to inform governors, that we will remain working virtually and using digital means until at least the end of September, given the current situation and not knowing where we stand. I had to provide some clarity to director colleagues in particular, and so we will stay as we are until the end of September. I've got 3 governors to thank for their service and who will be now leaving us. Andy Clegg from Leeds University, and we look forward to identifying Andy's replacement soon. And then we thank, and I have written to both Alan English and Marianne Oleneda Tewo for their service to the Council of Governors. And so thanks to Alan and to Marianne and to Andy for everything they've done. Just noting at item 3 that we have elections on the go at the moment for 3 constituencies, and that on the 4th of May we will know the results of those contested constituencies. And at item 5, I do want the council to recognise how Pauline Garnett served on the Governor Advisory Committee with distinction. And Pauline, I know you're present at the meeting. You've had a terrific attitude towards not being re-elected. I know you've been in touch with the new governor that's taken that place. And I wish to thank you on behalf of the whole council for everything you've done in raising the profile of Bradford and for your contribution to the wider picture. So very well done to you. And I can see there's some applause around the room. At key communications at item 7, this is one of them things where you kind of think, like, I don't know why we didn't think of this before, but when we began members' bulletins from the chairman, which I'm grateful for to Jackie for producing the initial drafts of those, we got some very nice feedback from somebody who said, have you ever thought of doing an easy read? And so, of course, we hadn't particularly thought of that. We will see what the take-up is and what's required, but I'm very pleased to note and to record that each member bulletin going forward now will also be available in an easy read format. And it's pleasing to note as well that we've commissioned that service from a well-respected local organisation who are experts in that sort of thing. Okay, so that's the point at which I'll finish my chairman's brief. In the absence of any questions, David, I'm assuming that's a hand from previously. Yeah, he's not coming in certainly, so it looks like it's a previous hand. I'll lower that in a minute then, and I will turn now then to Mel and ask for Mel to open up on the Chief Executive's report, which I think today is also going to include some input from our Chief Nurse and our Director of Human Resources in relation to patient safety and staff survey, respectively. So Mel, shall I pass to you first?
Yes, thank you, Chairman. So I am going to say a couple of words of introduction, but I was reflecting prior to the meeting of the previous meetings that I've attended since I've been here. And as you've quite rightly said, Max, there's always a very, very good attendance from our exec colleagues. But the opportunity for them to really sort of speak are quite limited. And I think that's a missed opportunity, if I'm honest, because call me biased, but I think we've got an incredibly talented leadership team here, and my exec colleagues are just phenomenal. And so when I get asked questions, it won't be a surprise to anybody that I go and I ask Karen and I ask Saj for the detail of exactly what's happening, and it seems wrong, therefore, that I should kind of sort of be seen to be giving you all the answers when actually the talented people that are part of my leadership team are the ones who really have the answers and really understand in intimate detail what is happening, and therefore are best placed, I think, to talk about it and to take questions about it. And so going forward, I would propose that we should do perhaps a little bit more of that. And so without further ado then, I'm going to just kick off by introducing my exec colleagues, but I'll sort of press you that with something that is new, and it's good. Of course, we'll talk about COVID, but, you know, spring is sprung, weather's changed, COVID numbers are decreasing. It would be nice, wouldn't it, not to always have to just talk about COVID. And just to drive that home, we have received, i.e. that we are in a new phase of COVID recovery and restart of things that will be our new normal, along with the relaxation of lockdown and all that goes with that. We received the what's called the operational financial planning guidance from the NHS executive just at the beginning of April. Now, this is a document that usually lands around Christmas time to give us time to plan ahead of the financial year, understanding what our operating budgets might be, our capital allocations might be, and some of the operational expectations that we will be required to meet, whether targets and standards change, and that would be the normal course of events. But of course, this time round, it's all about, as fast as we can, recovering from the unprecedented period that we've had over the last 12 months plus, and trying to re-establish ourselves into the disciplines and the rhythm of behaviours and the ways of operating that have usually served us very well as an NHS. So the priorities within that I will talk about very quickly before I hand over just to Sarge and then Ray, just to talk about elective recovery and where we are on our COVID inpatient numbers right now. Also on the issue of clinical prioritisation and how we are dealing with the enormous number of patients whose care has been and treatment has been delayed over the COVID time. Then I will pass over to Karen to, this is because I'm sweeping up in this section all the questions that you asked of me. So I'll hand over to Karen to talk about vaccinations and visiting. And then I'll hand over to Pat to reflect on some of the headlines from the staff survey and the process that we're going to go through after that. And then I will just answer a question that is will still be outstanding at that point about sort of staff wellbeing and where staff can go and have their lunch, etc. So just to trot through very quickly then, the operational priorities as they have been articulated to us for this coming year. Number one is supporting the health and wellbeing of staff and taking action on recruitment and retention. Number two is delivering the NHS COVID vaccination programme and continuing to meet the needs of patients with COVID-19. And you will hear from Sarge, unlike, this is not an unusual set of circumstances, it's pretty much how it was towards the end of phase one, wave one, towards the end of wave 2 and 3. Bradford is a laggard in seeing its numbers of COVID inpatients decline to the same rates that you might see elsewhere across West Yorkshire. And we know some of the reasons for that, but what it does mean is that we will have to contemplate having COVID around and making provision for having COVID around in our hospitals for the foreseeable future. Building on what we've learned during the pandemic to transform the delivery of services and restoring elective and cancer care, expanding primary care capacity to improve access, transforming community and urgent emergency care to prevent inappropriate attendance at emergency departments, and working collaboratively across systems to deliver on all of these priorities. And you've already touched upon the approach that we're employing to do that, and that is our Act as One programme and way of working across Bradford District and Craven, and also how we relate to our neighbouring trusts across the West Yorkshire and Harrogate footprint through our membership of Y-Act. So let me, they will be brief, and I've kind of implored them to be so, but succinct and giving you the most salient bits of information they can. So without further ado, Saj, and then Saj will hand over to Ray, and then we just do a baton relay, colleagues. That would be good, save time.
Thank you, Mel and Kevin. That was challenging, asking me to be brief. So I'll try and be really brief. So Mel's already outlined the fact that we've got the operational guidance through now, and as Mel's highlighted, real focus on restart and recovery. But we're doing that restart and recovery with a number of COVID positive patients in our bed base. So we currently still have 33 COVID patients in our bed base. That's 2 wards where we're caring for patients. We've got some patients on non-invasive ventilation and some small number of patients on intensive care units, on our intensive care unit as well. I won't give you the exact numbers just for the purpose of information governance, because when we get to small numbers, it gets potentially could become identifiable. Despite that, as Mel says, we've got those 2 wards at the moment dealing with COVID patients. We are starting our restart and elective recovery journey. And parts of the work we've been doing around that is segregating our estates so that we can safely care for patients who are COVID positive, but also safely care for patients who are coming in for elective surgery. On top of that, we've been working with our independent sector providers on the local patch, and we've got a contractual arrangement now as part of the operational planning guidance up until the end of September, where some patients will get operated on in the private sector. So huge amounts of work going on in terms of maintaining our COVID patients, to dealing with the non-elective patients, but then also getting up to a level of delivery for our elective patients. I'll pass over to Ray, and then Ray will describe how we prioritise those patients. Ray, over to yourself.
Thanks, Aj. And just to add, in terms of the COVID burden that we've got at the moment, as Saj said, our numbers remain relatively high compared to peers within the region, and that is a continued theme. What we are seeing, though, is that the numbers of the most sick patients, those needing intensive care and non-invasive ventilation, are less as a proportion of the overall number that we're seeing. And we are seeing, I was talking to colleagues from elderly care this morning, and they describe patients who they're still seeing admissions. Most of those patients, though, who are admitted have had at least one vaccine, and the very sickest ones amongst them are really significantly less than they were. So it does appear that the vaccine programme is genuinely having an impact. As Saj describes, as far as the restart goes, there's a huge backlog of work to get through, and we are certainly no exception in Bradford. So it's important that we do people in the right order from a clinical prioritisation standpoint. So at this stage, pretty much everybody on our waiting list has a priority level ascribed to them. So in very briefly, so that there are 4 main priority groups. Priority 1 to the emergency patients that we need to do today. Priority 2 patients need to be done within 1 month. Priority 3s can be done within 3 months, and priority 4s can be done at a period greater than 3 months. Those prioritisations have been, it's not a local decision, they've been agreed with national bodies, so medical rural colleges. So we're just applying those principles that are devised nationally. There are regular weekly meetings looking at our theatre lists, how we allocate those theatre lists according to those prioritisation schedules. So what are the P1s that we have to do today? And with the capacity for the rest of the week, how do we allocate those P2s? And we've got a clear plan in place to get action in very good time. I think the P3s and P4s, of course, will be more of a challenge, and that will involve working with partners to try and work our way through that. We know that because of the large number of patients waiting, sadly, some patients will suffer harm as a result. So in parallel with this, we do have a programme of work to undertake harm reviews of patients who have been waiting for longer than we would like, concentrating on those higher risk pathways, so cancer pathways, very long waiters, and patients who've been waiting well past their planned review date. So we're certainly not ignoring the fact that harm may come to patients. We're looking into that, and we're trying to actively manage it. Okay.
Thank you, Ray.
Okay, Karen, do you want to?
Thank you. So, thank you. I'll try and keep this as brief as possible. I've sent some slides out. I won't talk directly to them, but I will talk in things about them. But I'll start off just by talking a little bit about the vaccine. So the vaccines have been rolled out successfully across the city and across the trust. You'll be aware that we've been a hospital vaccination centre, and we're also the lead provider for the community vaccination centres as well in the centre of the town. So since middle of December, when we started the programme, we've vaccinated 270,000 people across Bradford, which is unbelievable. Some headlines on that: 93% of care home residents, over 90% of over 65-year-olds have now had the vaccine in Bradford and the wider city. and around about 75% of our staff have had the vaccine as well. We are aware that we want that figure to be higher, and we are continually looking at different ways to do that by focusing on different staff groups in different areas, but also by offering additional vaccines. So for the last few weeks, we've been able to offer the AZ vaccine as well as the Pfizer. You'll note though that after we started to do that, that's not can't be used for under 30s. So we have secured additional Pfizer vaccine for staff that still want to be vaccinated, and we continue to push that. We have an equality plan that is citywide, and also looks at staff, health and social care workers, and how to get the best vaccine coverage there. And we also have a risk on our strategic risk register that is around the risk of staff refusing to be vaccinated or not wanting to take us up on the vaccine. When you look at the breakdown of those, there's three lots of people that don't want the vaccines. There's those that are just refusing, they don't want it. There are people that are not eligible because they've got health conditions or they are pregnant and it's counterindicated. And there's a number of staff also that are actively involved in the vaccine trials, and they remain blinded and part of additional trials as well. So they are not showing in the vaccine figures at the moment either. I will pause there and I will move on to talk about some of the quality and safety stuff during COVID. I thought it was really timely to look back over the year, what is a difficult year, a year like no other, when we've ripped up the rule book, rewritten it, and then 5 minutes later ripped it up again and repeated numerous times. But what we wanted to do was to always focus on three things, and this is why at the end of this we've come out with relatively good outcomes for our patients and for our staff. We've focused on communication with patients, families, carers, and that includes visiting. And our visiting at the start of COVID and how we revised it and nuanced that to our population was one of the first of its kind in the country. And lots of other trusts followed what we did, including the rest of the trust in West Yorkshire. We absolutely focused on infection prevention and control and getting the basics right, hand washing, having the correct PPE, and we quickly set up what was known as the PPE hub. So we centralised all PPE. And I can report that not once have we had a member of staff that has not had the correct PPE, even right at the beginning when we were seeing some of the stories on the news and the media where healthcare workers didn't have the correct PPE, and nor have any of our staff reported feeling unsafe because of inadequate PPE. In addition to that, we put in something called our dynamic quality and safety tool. And this meant that in addition to our robust ways of looking at quality and safety, through datics and complaints and reports on feedback from staff and patients, we also put in additional checks, which meant that there was a very senior presence going into clinical areas and looking and seeing what was going on and asking a number of questions. And we, on a daily basis, would visit wards numerous times just to check that the staff were okay, the patients were okay, because we knew our staffing levels were below what we would have expected normally, and we had staff working on wards that weren't their normal ward, and staff needed lots of support. So there's some details in the slide pack around what we've done. Finally, I will move on to visiting and just touch on visiting. So as we move out of the pandemic, we still know that actually Bradford remains, although rates have fallen, one of the highest areas still for COVID infections nationally. And we want to be extremely cautious in how we reinstate visiting and how we do things differently. So we have already started to do a number of things within this. So we have a step plan that goes in line with national lockdown and lifting of restrictions, where we can stop and pause and review. So at the moment, we have reinstated visiting for people in longer than 14 days. That's on top of the visiting that we already had in place for people at the end of life or with cognitive impairments, children and our maternity services. We've enhanced visiting within the maternity services, and we are fully compliant with the national recommendations for maternity visiting, which means that birthing partners can be with the pregnant wife at clinic or for scan appointments, And we've always allowed a birthing partner in the labour room when somebody was actively giving birth as well. Going forward, we have engaged Maternity Voices Partnership around further relaxation of visiting within maternity. And the voices that we're hearing from women is that they do not want to go back to fully open visiting as we had previously. And that could, I don't know if anybody ever went to the maternity unit pre-pandemic, but, you know, 20, 30 people in a waiting room with balloons waiting to go in and see a new baby is not uncommon. And the women do not want to go back to that. So we need to do this in a controlled way so that people feel safe. In the wider wards, again, we want to make sure that when we reintroduce visiting again, we do this in a controlled way so that people can see their loved ones, and we do it for the best interest of the patient. But we will not be returning to what we would have recognised as normal anytime soon, I would suggest. I will pause there. Thank you.
Thank you, Karen. Mel, you are on mute, so if you want to come back in.
That's fine, thank you. I would just ask Pat now to come in on the patient, the staff satisfaction.
Yeah, sure. Thanks, Mel. So again, I did send through some slides last night that you should have got. So just some key themes from those. So in terms of the staff survey, it ran between September and December last year. The survey obviously captures the experience of staff, and this time captured the experience of staff through the pandemic. So dependent on where you were in the country or the type of organisation you worked in, the experience this year was very different, which is reflected through the results. You will see from the presentation that certainly we had more staff who worked in a COVID ward or department, more staff who were redeployed, and less staff who worked remotely than the national picture. In terms of the survey results, these are themed, and you can see sort of the summary on pages 3 and 4 of the slides. Disappointingly, we did see a statistically significant reduction in 5 areas of the results, and those are around immediate managers, morale, safe environment, particularly bullying and harassment, staff engagement, and team working. I think that the results were undoubtedly affected by the number of staff that we had redeployed, number of staff working in different teams, and the sort of extreme pressure that staff were under at that time. But I think it was, you know, it would be fair to say that some of the results were disappointing, given the sort of staff engagement activity we did over those 12 months. In terms of, you know, where did we do well? We actually did well on the quality of care indicators. We did well on the safety culture questions, and we did well on staff feeling that the trust took positive action on their health and well-being. And in terms of our 5-year trends on recommending the trust as a place to work, or recommending the trust as a place for treatment, again, we maintained positive movements in those key areas. Where though do we need to improve? Well, really, it's that whole area of how our staff are supported. And that's not just support by managers, but it's also support from colleagues, how people treat each other, how we respect each other, how we tackle bullying and harassment, how we change the language and focus around that. And again, that's both the experience from patients and relatives, and also managers and colleagues, and how we feed in that whole kindness piece of work. So in terms of what next, we did a detailed presentation and discussion at People Academy. We've shared the results with our CBUs and corporate departments, and there's some real differential results between our CBUs and departments, and some CBUs who have done really well. We've held some focus groups in the last couple of weeks with staff members. And we're going to be presenting to this the next EDI council meeting, the staff survey results through an EDI lens. So we can look at the experiences of obviously our staff groups with protected characteristics. So from that, we'll then be pulling together some key corporate actions going forward and working with our CBUs in terms of areas to improve. But really, just to finish, like our focus corporately is going to be around creating that culture of civility and respect in the workplace, building on our kindness work, which is going to be sort of a big cultural change programme for us going forwards, which we plan to start when our new head of OD starts, and that will underpin our work programme around the staff survey and broader staff engagement. And we'll obviously be reporting through People Academy going forwards. So that was really quick, but just a quick overview.
Well, and colleagues have had the slides, of course, Pat, and I will open for questions and any detail that people require. So thank you. Mel, I'll come back to you, and you just, yeah.
Thanks. So thank you, colleagues. There was another question, I think, around seating for staff and breakout areas and things like that. And I appreciate if people haven't been walking through the hospital, but any areas where we did have some seating that we removed basically to stop encouraging people to sit, because it was clearly going to be breaking the social distancing rules. And John and Pat actually collectively worked and have throughout COVID worked on a programme around safe workspaces, and that related to non-clinical areas, which included staff rooms, breakout rooms, etc. So the plan would be to maintain, in line with the trajectory around releasing lockdown. At the moment, of course, you can sit and congregate. You're supposed to still socially distance, but the preference, of course, is at the moment to do that outdoors. So we're not proposing to put seating arrangements back in as they were before COVID came along, until that really is the kind of thing that you would expect to happen outside of the hospital environment as well. So when it's safe to congregate in open, in rather enclosed spaces. But in line with some of that around the staff facilities agenda, I just wanted to flag up a couple of things that are really, really important and significant that we are investing in to help support our staff and maintain their wellbeing. So if you remember that first priority, supporting the health and wellbeing of staff. So what COVID taught us was we had very, very poor changing facilities. So when suddenly you have to police staff changing into scrubs and then changing out of scrubs so that they don't travel in their uniforms to protect infection control practices, then of course immediately you are hit with the staff saying, but we haven't got the right facilities. And then when you go and have a look at the facilities, which I did, you kind of think, well, they're absolutely right, because I wouldn't want to get changed in some of the facilities that we currently have. They need a really radical overhaul. So we did some of that immediately in the COVID period. We did some decoration and we got new lockers and we did various things. But really, that was just a short-term measure. What we're doing is a complete revamp of staff changing facilities, and we're going to put something really very spectacular in our BRI site and at St Luke's, where staff can keep the property safe, have showers, use facilities, even have drying cabinets for those staff who choose to cycle in and get wet, and they can keep their clothes there so that when they finish the shift they can put dry clothes back on to cycle home. So all those kinds of things that really mean a lot and make a difference to staff. The second thing that we're doing is we're putting in staff hubs. So some of the basic things that staff really complain about is access to hot food out of hours, access to drinks, somewhere to go that is private and is conducive to them having a bit of downtime. And we have nowhere like that. We have small areas, and we created the wobble rooms again. There's a bit of a sort of a temporary fix, although they're still there and they're available, but that there isn't a communal place where you can go and make hot food for yourself, particularly when some of the outlets have closed. So we're going to drop in a huge staff hub right in the courtyard outside Costa, which will have facilities, kitchen, internet access, television, etc., where staff can go and relax for a bit, take their breaks if they want to leave the ward area and have something to eat. Hopefully by the time they're up and running, we will be in a position where it's okay for staff to convene around a particular location to do that kind of stuff later on in the year. We're also taking the opportunity to enhance our gardens and put in some benches and potentially picnic tables and things like that, so that throughout the summer, staff can avail themselves of those facilities if they want to go outside and have somewhere pleasant to eat their lunch or have their breaks. And we did a little bit of that again in a temporary way, but a quick way. In the middle of COVID last year, when it was very hot in the summer, we got lots of deck chairs, and they were sort of deployed around the trust and the gardens that we have. But we're doing that in a much more concerted effort. And the final piece of that is to encourage cycling. We've got 2 big brand new cycling compounds about to land in St Luke's Hospital and on the BRI site. The BRI should house about 30 cycles, very state-of-the-art, ultra-safe, secure compound to encourage people who now, have very expensive electric bikes and things like that to use their bikes to come to work as an alternative to using public transport. Good for their health and well-being and good for the environment. And whatever we do at BRI, we mirror at St Luke's. Might be on a slightly smaller scale because there are fewer staff comparatively there, but we make sure that we have that equality across both of those areas. So that's it, Max. Thank you.
That's great, Mel. Thanks very much, and thanks to exec colleagues who were able to contribute their little bits of detail there. Thank you. Now, I've just got one outstanding matter potentially from that. Karen talked about vaccine hesitancy among staff. We're clear that it's not mandatory, and we don't have any authority of that nature. But I just wanted to be sure that governors were clear of our position regarding how we follow up and encourage staff to take the vaccine, and whether the sessions, the specific sessions we've been running, are thought to have been useful in that regard.
I'll defer to Karen, actually. I know that the sessions have been well attended, and we've sought to identify clinical leaders in particular who could reassure people about their hesitancy. I'll let Karen and maybe even Pat tell you what the outcome of that is in terms of follow-up with individuals on an individual basis.
Thank you.
Thanks. So there's a number of things that we're doing. So one is about people having conversations, and you have to be very careful about that. And we have had some feedback that some staff felt pressured around the vaccine, but we are asking staff why they don't want the vaccine. They don't have to tell us. A lot of it is still around, I'm 30, I'm fit and well, I'm not gonna, it's not gonna be any harm for me. Nobody knows what the long-term effects of the vaccines are yet, etc. So what we've tried to do is do a lot of myth busting. So we've done sessions around fertility. We've used experts in the field. So Ginny Bottomley did something on fertility. We've had people talking around Ramadan, vaccine hesitancy, the content of the vaccine as well for our Muslim staff. We continue to get trickles of staff still wanting the vaccine, and I think as it's become more rolled out in the community, and more families are having the vaccine, staff are seem to be coming around a little bit more. But I think you will always have a cohort of people that don't want to be vaccinated, and it's extremely difficult. What we can do, though, and we have done, is I've had conversations with the university, around students that don't want to be vaccinated, and we've said that that's fine and is their choice, but we don't want to have a risk of unvaccinated students in some of our most high-risk areas. So if you choose and want to come to somewhere like intensive care or the neonatal unit, we would expect you to have your COVID vaccine, or you can go to a lot more low-risk area. And we will also, in time, look at staff that haven't been vaccinated, because it might be that we have to allocate them to certain wards or certain areas of lower risk. But at this time, we've continued to encourage staff, and staff are taking us up, but that has slowed down.
Yeah, probably, Max, the only thing I would add is that we also sent a letter to all frontline staff who we didn't have them recorded as having had a vaccine from our occupational health department. So we sent out an individual letter. We encouraged people to tell us if they'd had a vaccination elsewhere, and also gave quite a lot of information around the vaccine from those letters, and encouraged staff to take up the offer. We're just replicating that now with our new starters in the last 2 months.
That's really helpful. Karen and Pat, thank you very much indeed. That's terrific additional detail. So what have we heard? John, I know you want to come in, and can I just mention to colleagues as well that we are obviously recording the chat, so if there's issues you want to put in there, and thank you to those colleagues who are responding to any questions that are placed in chat. So we heard about operational pressures and the way in which we're trying to prioritise clinically patients, heard about harm reviews, vaccine achievements and some hesitancy, quality and safety issues, the issues regarding visiting, reinstatement of visiting, staff survey and the importance of our ongoing civility and respect agenda, and very much a focus on well-being of staff. So here's an opportunity for governors to open up and ask any questions of any additional detail that they might want. I'll begin by bringing John Prashar in, who I think, John, you wanted to make a point.
Thanks, Max. Can you hear me okay?
Yes, you're coming through clear, John.
Great. I just wanted to make an observation on behalf of myself and Selina, really for the purpose of the minutes, in terms of People Academy and our discussions, and I'm sure that other non-executive colleagues will concur with this. We've heard a lot of granular detail today from Mel and her colleagues, and it was interesting, I think, that Mel used the word spectacular, because I think it's quite an interesting word, and I really do truly believe a lot of what we've achieved in these very challenging times has actually been spectacular. And I just wanted to draw to people's attention 3 or 4 very quick areas, Max, if I may, please.
Please do, John, yeah.
The whole issue of staff patience, staff resilience, and the approachability of staff, I have found amazing in these pressurised times. You know, we're still trying to seek assurance and sometimes be seen to be perhaps taken away from the core delivery day to day, but the patience of staff and the focus staff have given to some of those important issues, I think, has been spectacular. The whole concept of kindness, civility and respect, I think so much of what we do as an organisation has been built on this, and I think culturally we're really moving in the right direction on that. And for the purpose of the minutes particularly, I did mention in the pre-meeting the excellent, I think I'll use that word, leadership that Mel and her executive colleagues and Kes Hayat in particular have shown on the equality agenda, because it would be easy in these pressurised times to see this as taking a bit of a back seat and dealing with much more core day-to-day issues. But obviously these are fundamental to what we get right and what we do spectacularly in Bradford. And I think Mel has really enhanced this agenda, Max. And I wanted that recorded for the minutes, because I think we really have got some stuff we ought to be proud of.
Thanks very much, John. Thank you. So, Governor colleagues, I appreciate that was done at pace, and there are, of course, some reports appended to the papers that I hope you've had the chance to read, or that you will get the chance to look at, which some of additional detail and reminders. But there's an opportunity now, if anybody wishes to ask questions. All that was under the auspices of the Chief Executive's report. So if anybody wants to direct any questions towards Mel for onward direction to anybody else, please do come in now. And I see no hands raised, Mel, so I think the governors have benefited significantly.
Max,
Yeah.
I see Pauline's hand up. I'm not sure if you can or...
Okay, I'll bring, do you know, so I must be having a problem with my system here at the moment. I can't see a hand from Pauline, but Pauline, would you like to ask a question?
Yes, I was going to echo what John Prashar said, because I've taken part in a number of meetings, very positive about the EDI agenda, and to have that positive leadership from Mel and from the team. And so many staff just really appreciate the journey and what's happening at the moment. And I can see, and it's really exciting to see a number of the positive initiatives that will be taking place. So I just really want to say thank you. A quick question for Pat Campbell about the staff survey. I was just wondering, because there are when you look down on the finer detail, there are a number of disparities between various CBU and different departments. And I know there are some good practices taking place in some areas, but I just thought that what would be good would be sometime to be able to capture some of those good practices that are taking place. You know, some of the areas are not performing as well, and it's trying to be able to learn and share, you know, about tapping into those.
Yeah, that's what we're planning to do, Pauline, and we're also looking at perhaps partnering up some CBUs.
Yes.
In terms of areas that have done really well and areas where there is room for improvement.
Brilliant. Thank you. Brilliant.
Thank you, Pauline. Yeah. Am I right that there are no further hands raised? Yeah, I think that's the case, isn't it? Yeah. Okay. Thanks very much, everyone. That really useful report. And again, thanks to exec colleagues for coming in there. Okay, we'll move on to item 8 now then, please, which is the academy governance model update. And we'll just invite Laura to bring to governor's attention what we're doing regarding ward to board assurance and the way in which we're developing our academies. So Laura, I'll turn to you now.
Yeah, thanks, Max. I'll just share the slides if that's okay.
Thank you.
So I think it's just loading up. Apologies about this.
No, it's up. I can see that.
Can
now.
you see it? All right, must be my screen that's a bit slower. Okay. So as governors will be aware, we've now got a new governance structure in place, which was agreed last year following quite a lot of discussions, and we had an independent governance review as well, and this is the new structure which we've now got in place. So this structure is now operational, and all of the academies are meeting on a monthly basis. We've also got terms of reference and work plans agreed for those academies, and some updated terms of reference agreed for the Regulation and Assurance Committee, and we've recently just reviewed the Audit Committee terms of reference as well. So we've tried to ensure that we've got a clear distinction between the role of the board, the audit committee, the regulation committee and the academies. So just set out on the slide there, I've just given a brief overview of the role of each of those forums. So the board's got overall responsibility for the performance of the trust, and it's supported by the Regulation and Assurance Committee, which seeks assurance on the delivery of the trust's strategic objectives and statutory duties. And the academies support the Regulation and Assurance Committee through seeking assurance, ensuring learning and driving improvement in relation to their areas of responsibility. And the Academy chairs provide reports to the Regulation and Assurance Committee, and supporting papers are also provided for reference. The Audit Committee is focused around the governance structures and assurance processes and ensuring that they're robust. So that's kind of, a separate focus to the Regulation and Assurance Committee, which looks at ongoing assurances and operational matters, whereas the Audit Committee focus is around those supporting structures and processes. We're going to have an interim review of the academies in July this year, just to assess how they're going and if any changes need to be made. And there'll be an annual review next March. So I'm just going to hand over now to the chairs of each of the academies just to give a brief overview of what each of the academies has been discussing so far. So I think we've got Quality Academy first. Ray or Karen?
Yep. Thanks, Laura. I'll keep it very brief. Just so if you look at the definition of an academy, it's a society of distinguished scholars that aims to promote and maintain standards in its field. And I think that it's that improvement that we want to really focus on. So learning and improvement to drive the assurance, and that's what's really important. So quality, it can be difficult to define exactly what quality means, but for our patient group, we're really looking at safety, outcomes and patient experience principally. So we've had 3 meetings so far, starting in January. The meetings are scheduled monthly with the exception of 2, so August and December, so we'll have 10 meetings per year. So Karen as Chief Nurse and myself as Chief Medical Officer are joint chairs. We've deliberately got quite a wide membership because it's important really to have as many groups represented as possible, and that's really been, I think, facilitated very well by the virtual format that we've all learned to live with over the past year, and participation so far has been really good. So there are some examples on there of what we've considered so far. I don't propose to read those out. Just draw your attention to a couple of those things. So the quality dashboard, this is something which has been around for a while. We're looking at that to try and make it as meaningful as possible and to make sure that the data accuracy in that dashboard is as good as we can possibly make it. And the other thing I just wanted to draw your attention to is the oversight and exception profile. So this was really developed in response to the pandemic to make sure that the quality of patient care was maintained and managed despite the challenges that we've been facing. So in terms of the Quality Academy, what we want to do is work with the clinical business units, because in the end they are the units which have that direct patient care, and we don't want to do quality to the CBUs. We want to work with them to support them so that quality and safety and experience and outcomes is part of everything that everyone in each CBU does. So it's a supportive function, it's a developmental function. There is no doubt that it will evolve, I think, as time goes on, but I think our experience so far has been really positive. So I'll leave it at that, Laura, if that's okay.
Thanks, Ray. So I'll hand over to Pat next for People Academy.
Okay, thanks, Laura. So in terms of the People Academy, we met September last year, and then we've met since January this year. A bit like the Quality Academy, we also have a sort of wide and diverse membership. And I think that has enabled, certainly so far, a really great debate on topics. So the membership is drawn from the sort of wider HR team, the education department, the staff networks, staff side, some management reps from across the trust, and we also have good non-executive engagement. We have a work plan which is evolving, and we sort of try to structure the agenda. So we've sort of a key topic or a key focus at each meeting, which is linked to an area of the NHS People Plan and sort of a key delivery area. So as an example, April's meeting, the focus will be on flexible working, because that's a key priority for us to action. And then the May meeting we've already devoted to an equality focus around ARES, WIDES, etc. Again, I don't propose to go through the examples of items considered so far. A bit like the Quality Academy, we're also reviewing our people dashboard. So it is sort of will help us more in terms of both sort of qualitative and quantitative metrics, and the sort of the examples really just demonstrates, I suppose, the breadth of areas that we are starting to consider through the Academy. So that's probably all, Laura. Thank you.
Thank you. And then finally, we've got the Finance and Performance Academy. So I think, Julie, are you going to provide the update?
Yes, can do, Laura. Thank you. So we talked a bit about the Finance and Academy in the pre-meeting, so I'll keep it short. So you can see the purpose of the Academy at the top. In some senses, a lot of the assurance stuff we'd already been doing in the previous Finance and Performance Committee. So what we're trying to do is strengthen our learning and driving improvement bit. And you can see some of the areas we've looked at as part of that. So we're going to receive quarterly the Actors 1, so the Bradford System programme updates and what's happening in them. And we had an update at our last meeting on the Wyatt programmes. So the ICS update. So in some senses, all of those different, the improvements that are happening in our hierarchy level, so some at the Bradford level, some at the West Yorkshire level, and some in the trust, will be focusing in the meeting. We've got a smaller cast list than the 2 other academies, and I think we're keen to look at those and see if we need to be doing more in the Finance and Performance Academy. We are trying to invite people in when we need them and do it that way, but we will see how that goes. And we have got some new members around the table, and we're keen that they stay engaged and involved. So we've got the Director of Transformation, we've got the Director of Planned and the Director of Unplanned Care. So really good to have them around the table. The assurance bits are the standard stuff we've been doing anyway. So we kind of chunk it into the finance and performance. So do a section on finance and a section on performance. We've also asked estates to come in and share with us some of the improvements from the estates plan, and we'll plan to get those in quarterly, and Mark's agreed to look at a report that will come in and share those with us. So nothing else to add unless anybody's got any questions.
Thank you. Yeah, we'll leave it there for questions. I'll take the slides down.
Thanks, Laura.
Thanks, Laura. Thank you very much. And John, may I just check with you? I know you were going to talk with exec colleagues about the potential for governors to have sight of work in progress at academies. Have any of those discussions developed yet about ways in which we might make academy business visible to governors?
Yeah, I think there's probably more we can do to consider that, but at the moment our default is we want to make sure that the business of our academies gets picked up as part of the AGM, where we want to talk about how the trust works and what it does on behalf of the population we serve, and we'd want to make sure that governors benefited from that too. You know, I think this is a work in progress. We don't have all the answers at the moment. To be honest with you, what I don't think we can do is create a further level of kind of reporting and accountability and quasi-governance, where every time we do anything, we play it back through the governors. I don't think you're asking that. We do want to do something around the AGM, which is, you know, for the benefit of our community. I think the challenge for us is making sure we've got the balance right, and is there anything more we should do for this forum? And we will think about that, Max.
Yeah, thanks very much, John. I know it was a conversation I'd had with you to share with exec colleagues. Thank you. Wendy, would you like to come in?
Yes, thank you very much for the presentations. I want to say 2 things. I observed the regulation committee in February. Was it February or March? Anyway, after the first academy round had happened, and I was certainly reassured about hearing about what was happening in the academies, and I thought the discussions at the regulation committee were very detailed and challenging, and I was impressed with that. What I'd like, and I don't know whether other governors feel the same way, but I think one of the problems when we hear presentations about things, it's on a quite a sort of strategic level, and it would be really good to have some practical examples of something that's gone through the academy, a problem, an issue, and the outcome, the learning and the outcome. It's probably too early at the moment to do that, but I think for us it would colour in the words that you're presenting to us about what is happening there. So.
That's very fair. That's very fair, Wendy. I don't know whether would any of the chairs wish to come back on that. It's a reasonable challenge, and would demonstrate the way in which we're getting that waterboard assurance. Or do we simply accept the point? We need some working examples. Yeah. Okay. Thank you, Wendy.
Max, I think Pat's got a hand up.
Pat, would you like to come in? Yeah.
Yeah, I suppose I was just going to give a quick example quickly around improving our disciplinary practices, because that was a subject we discussed at Academy 2 months ago, and that was on the back of a Dido Harding letter to the chairs, and Prana is our letter to directors of HR. And so we obviously had a full discussion at People Academy, what that meant to our disciplinary processes, which resulted in a paper going to our board of directors in terms of recommending changes and what those changes would mean. And the board obviously agreeing proposals, which will result back in actually substantive changes to our disciplinary policy and practice, which will be in place by the end of June.
That's very helpful, Pat. Thank you. Am I right in thinking there are no further hands raised? Yeah, thank you. And so we're asked to note the developments with the Academy governance model, and I think it's quite encouraging, and hopefully governors are well sighted now on where we are there. Okay, thanks everybody. I'm going to move now to, we've 3 decisions to make now as a Council of Governors. I think, Jackie, I think you're going to lead us through these. So shall we begin with the annual members meeting, AGM?
Okay, this is a quick one, it's a verbal item, but the date for the AGM and the annual members meeting has been set for the 28th of September from 5 p.m. to 7 p.m. and it is in everybody's diaries. Last year our AGM received 536 views on YouTube. Now, and we had approximately 70 people who had watched it live. We are going to deliver it virtually again this year. But, you know, kind of we want to start planning for that much sooner than we did last year, just to think about how we want to deliver it. So the key thing is setting up a group, governor working group, to get involved in that. And so what I'm asking for is for governors to get in touch by Monday, the 26th of April, to express their interest in joining that group. I think as well, it's also bearing in mind what John was saying, just thinking about the method with which we'll be delivering, you know, kind of information, the use of video, maybe, and other materials and things, just so that we can get something that builds on what we did last year, but you know, kind of moves away from that podium presentation. So I think there's quite a bit to think about and deliver back to the governors in July, so that we can then start publicising and promoting and having some substance to those communications that go out to invite people to participate on the 28th.
Great stuff, Jackie, thanks. The video item was terrific as well, wasn't it?
Yeah, it was.
Last AGM, so yeah, very powerful. Thanks very much. So we're simply being asked to note that, governors. Does anybody wish to make any comments, have any particular thoughts about the AGM? Content with the dates, content with the intentions to plan early, obviously involve governors. Yeah, great. Okay, thanks everybody. We note that. And we'll go to item 10 then, Jackie, please, for the annual governor evaluation. I do just want to ask, I know the proposal here is that we'll convene a special session, but I did promise at the quarterly meeting that if anybody wanted to say anything at the moment, we'd offer the opportunity for that. But I'll pass to you, Jackie, for the annual governor evaluation, item 10.
Yeah, so I just wanted to provide a brief summary. Of you said, Max, we want to convene a special session to really kind of get to grips with the information that has been wonderfully shared by governors. We've had a good number of responses to the evaluation, and I'd just like to say that overall we received exceptionally positive feedback regarding yourself, Max, the chair, and governors overall felt that they had good opportunities to contribute to meetings, and overall generally we had good feedback for the management of meetings. If you'll look through the cover sheet, it particularly talks about those areas marked red and amber, based on the scoring mechanism that we've used. And so in summary, I'll just focus right now on the red rated areas, which were around governor induction, representing the interests of FT members and local population, and the council's satisfaction with how the council's business and decisions are communicated externally. Now, I think, you know, kind of we've provided some solutions if you look at the appendix, or proposed solutions, which we'd really like to kind of discuss with governors to kind of pin down and work out how we're going to deal with, you know, kind of respond to some of those areas and seek improvements as well. And so that's what really like kind of governors to focus on. If they've got any questions and comments, please get back to us. But if you could think about taking part within a session to develop an action plan in relation to the improvements, that would be great. I think that would be good for all of us. So I'm hoping that the governors, you know, kind of sanction the setting up of that session to go through the detail that they've provided within the evaluation.
Thanks, Jackie. I guess there's a potential for a link here to item 11 as well.
There is, yeah.
To number 11, but there are obviously things arise from that skills and knowledge audit proposals for action.
I mean, if you want, I can move on to that as well, because I do think it would be worth to build some of that into a development, you know, kind of a session with the governors to pick up on some of the comments, particularly that people have made. I think, you know, kind of some areas it's quite clear within the skills and knowledge audit, and it's documented there in the paper about the areas that we do need to, you know, kind of focus on in terms of their, you know, kind of learning and development, key areas, key priorities for this year around, say, quality, safety and patient experience, performance, foundation, trust strategy. They're kind of the key things I think that do come up each year. And so it's just about us refining how we deliver sessions on those, and a lot of things we can actually deliver through the induction programme, which is actually being developed at the moment. Things around membership, which you know, kind of is very high on the priorities for governors. We can deliver that through the membership plan. So I think, you know, kind of that there are quite a few actions. It looks like quite a lot proposed, but there are different avenues for delivering on some of those. And the beauty about this is I think we can, you know, kind of finally capture in one place a development plan for governors throughout the year that we can monitor, you know, kind of as we go along and see how governors feel, but also look at those areas where governors might not feel strong enough in terms of delivering their duties and responsibilities, particularly around membership engagement, because I think, you know, kind of that's always been a bit of a bugbear for governors. So we can put some very practical things in place to support governors, but also for governors to support themselves, because when you look at the areas of expertise that governors have, it's phenomenally broad. So I think there's scope for governors to be, you know, kind of more independent and proactive in supporting themselves as well, in terms of, you know, kind of areas that come up for discussion.
That's great, Jackie. Well, what I'll do is I'll come back to the recommendations on paper 10.
Yeah.
Then in relation to paper 11, the governor's skill and knowledge audit, given that they're kind of similar things, is there anything more you wish to say about that paper 11 before we go to the decisions for governors to consider?
There isn't, because I think, you know, kind of if you look at the paper, it's fairly structurally, you know, kind of laid out in terms of the actions proposed and you know, kind of what we've actually discovered and so on. You know, in terms of personal development needs, the national trading provider Governwell is you know, kind of providing specific courses. So we will actually set up collectively for governors a session that looks at, you know, kind of member and public engagement and NHS finance and business skills. Other areas we can do on an as and when basis. It's recognising the areas of expertise and using those to support other initiatives. We've got information about the work outside of council meetings, and this is the extra kind of programme that we put together, you know, kind of where we need governors to support us in doing a number of things. You know, kind of we recognise which areas governors feel are the most important, membership communications and Ned and Chair appointments. So I think, you know, kind of for that one, it's about looking at those, you know, kind of the way in which we propose to deal with those actions and agreeing that. And if there is further discussion to be had, we can do that when we talk about the annual evaluation.
Yeah, yeah. Okay, that's really helpful, Jackie. Okay. So, Governors, what we've done there is we've tried to briefly summarise the two papers. It's item 10 and item 11. Item 11 is the skills and knowledge audit. And what you're being asked there is if you agree with the actions proposed within that paper, and that the suggestion is that matters arising from that, the actions arising from that, could be part of the same session for paper 10, which is the annual governor evaluation. And at that paper, you've been asked to review the results of the self-assessment, consider those recommendations, and determine whether it's a good idea to convene a special session to go through those recommendations and actions, particularly in relation to the red and amber rated areas, and to consider comments. So that's the suggestions, and it's kind of sensible to take those together. I will open up for any questions or comments. Stella, you are unmuted, so did you wish to say something, please? Can you hear me okay? No, Stella's not got her, I'll try again. Stella, can you hear me okay?
I can, yeah.
Yeah, I just wondered, you've unmuted, and I wondered if that meant you wanted to make a comment or ask a question about these matters.
No, I was commending the last comments that our friend was making.
Okay.
Jackie, and I couldn't get through, so I got for help, because I'm only in the 19th century. Don't put that on the minutes.
Was there any particular aspect of what Jackie presented there that you wanted to endorse your agreement?
Not particularly, because it is all commendable, actually, and I'm certainly prepared, as I hope others are, to work with her on it.
Great stuff, Stella. That's very helpful. Thank you very much.
Thank
now,
you.
I'm obviously slightly nervous today with my tech, that it isn't always showing me any hands up, so I'll just make sure. I can't see any raised hands at the moment, but I do want to ask whether governors wish to ask any further questions in relation to this before I move to asking if you approve the recommendations. So I don't see any hands raised, am I correct? Yeah. Okay. So there's the recommendations. In relation to paper 10, review the results, consider them, and let's convene a special session to discuss them. And in relation to paper 11, let's take the findings from that into that special session. Is that all agreed? Is there any dissent to that? Yeah, I can see lots of thumbs up, and I don't see any hands up for raising any dissent to that. So we're agreeing on a way forward, and it deserves some time. I did say to governors that I would open for any comments that wanted to be made today, but it's good that we're going to spend some proper time on that. So we'll get a session going for that. Okay. Thanks, everybody. We'll move to paper 12, which is the Governor's Code of Conduct. And I'll turn back to you, Laura. It's pleasing to see that governors have been involved in the review of this, but I'll ask you to bring to attention what council need to consider.
Yeah, thank you. So we've agreed a code of conduct which supports governors in their role and clarifies the expected standards of conduct and behaviour, and governors are required to confirm that they'll comply with the code when they're first elected or appointed to the council. So we've reviewed the code and it's been updated, and that's been supported by a working group which has included Amit Bhagwat, Stella Hall and Wendy McQuillan, and Jackie and myself have supported that group. We've made a range of amendments and the updated version of the code's attached to Appendix A. And the main amendments include a new appendix which relates to media and communications, so providing some additional guidance to governors there around contact with the media. We've confirmed that the code will be reviewed on an annual basis just to make sure that it's kept up to date, and we'll do a full review at least every 3 years. And we've also made some amendments just to try and improve the flow and the clarity of the document. So we're asking the council to approve the revised code of conduct as attached, and happy to take any questions.
Thank you very much, Laura. I don't know whether Wendy or Stella would wish to add anything to that. I'll assume not without raised hands. So council have asked if they approve the revised code of conduct as attached to Appendix A. Are we content to do that? Yeah?
I'm not sure if Stella wants to come in.
Okay, Stella, would you like to say something about that? You're just on mute, Stella, so are you able to unmute?
It's coming.
I can see an arm coming in to help you.
Yeah, our special person. No, we worked very hard on this, but what I must say is every member of the Council of Governors has to read it seriously and know that it is a very dominant requirement of each of us. And it is not easy to do. And we all have to go through each point and know that we commend it for ourselves as well as our peers. It's enjoyable as well, though. I'll put that in.
Okay. Thanks very much, Stella. Obviously, people are being asked if they approve it today, and I'm hoping people have had the chance to read it. But now is an opportunity to say anything. But Stella makes the point of how important a document it is, and that's absolutely right. Pauline, would you like to come in?
Yeah, because I noticed it's just for the first term. It just said, I'm trying to think about existing governors at the moment. So, because it applies to all governors, as Stella's saying, but I just know it just said just sign if you're in the first term of office. So I'm just trying to think about existing governors.
Laura, do you have did the team think about?
Yeah, well, we could ask governors to sign it, you know, upon each term of office. So if they are re-elected, we could ask them to, to sign again, just to confirm that they'll continue to comply with it.
I think if I've picked up Pauline's point right, she's saying shouldn't we invite all governors to now sign that revised code of conduct?
Yes.
Oh yeah,
Yes,
sorry, yeah. Now we've got the amended version. Yes, we'll do that.
I mean, it's a suggestion from Pauline. I'll put it as a proposal to council from the chair, because obviously if governors are approving it, then we would ask that would be done. So can I assume that governors would be comfortable if they're approving that code of conduct to re-sign the code of conduct?
Yes.
Yeah. Okay. In the absence of anybody dissenting from that, we can assume that that'd be okay. Yeah. And Alistair, would you like to come in?
Yeah, just a very short comment, because it overlaps with some of the previous stuff we were discussing, in the sense that when you look at the personal conduct as a member of the Council of Governors, Bradford Teaching Hospitals Foundation Trust, there's a list of 22 points, and some of those points, I'll highlight one, point 12, is a good example of the things that I think, depending on who governors represent, who their constituency is, don't necessarily know how to do it. And I think so while we're signing up to it, we're also saying we may need some training to be able to fulfill the full commitment.
Thanks, Alistair. And can I make sure, Laura, that aspect, item 12, there is included in that intended discussion regarding representation of constituents?
Yeah, we'll make sure that that's part of that discussion, and I think that's something that we'll pick up through reviewing the membership plan as well, and agreeing sort of a programme of membership engagement activities through that, which should support governors.
Thank you. Thanks very much. Jackie, did I see a raised hand there from yourself?
No, I'm okay, because Laura's made the point that I wanted to make, just in terms of that. I think you're right, absolutely, because those things do need to be we need to make sure we can deliver on them, and that people have the skills to be able to do that. We can't do it for you, but if we can give you the skills to do it, then, you know, kind of there are ways and means. So yeah.
That's fine. And I see from the notes in the chat that part of the discussion to take place might be about aspects of practical support that the trust can give to allow you to fulfil that duty. So we'll pick up on that. I can see that being quite a wide discussion, actually, so I think that'll be really useful. Okay, thanks. Again, I'm desperately hoping I keep refreshing the participants to see if any other hands have come up, so I don't see any further hands there. So we're being asked, please, to approve the revised code of conduct, and we note that it's been agreed here at council that all governors will be asked to re-sign that new code of conduct. Yeah, people content with that? Yeah. Without dissent? Yeah, that's great. Thanks very much, everyone. Okay, we'll move on from that. I'm going to now go to Council of Governors standing orders. I'm sorry, there's a few transactional things to do here, but it's great. It's Laura picking up on the bits we to tidy up. So we'll now move to Council of Governors, our standing orders, which have some track changes in, Laura, yeah?
That's right, yes. So we review the standing orders on an annual basis. I think given the situation last year, they were extended for an additional year. So now we'd like to bring them just for a review and update. The amendments are listed in track changes within the appendix, and I don't think there's anything material there. That they're mainly fairly minor, just to make sure that the standing orders remain up to date. And they're listed in the cover paper as well. I would like to propose a further amendment. This relates to paragraph 3.2.1, which talks about the notice of meetings being placed in the local media. But we haven't actually done that routinely, so I would propose that that is removed. We do advertise meetings via the Trust website, but not in the local media, so I would suggest that that is removed as well.
Oddly enough, if I may,
Let's just come in, yeah, please do.
Oddly enough, I think that's just the sort of thing that some of the representatives from the districts, not the universities, but different, might think they need in order to start communicating with their constituents, and for their constituents to know that such a thing exists. But I should really let them speak for themselves.
So looking at public governors, how would you feel about us not putting in the local media? How important do we feel that is, that we put the details of our Council of Governors meetings? David, shall I review it? Yeah.
I mean, I agree absolutely with Alistair. I think it's something we should be doing. We need as much publicity for this organisation as we can get.
Okay, and Wendy and then Kirsch.
Yeah, I agree.
I agree as well with Alistair's comment, particularly in the light of the discussion that we've been having earlier about public engagement, and maybe we can extend that to other forms of publicity.
Thank you, Wendy. Kirsch?
Yeah, again, I think we're all in agreement with that. I think we discussed it earlier on as well. It's pointless being a public governor and nobody knowing who you are, what you do, and how you can help them. It just seems silly that we're not doing that. The only concern that I have is, have we, as a trust, got the capacity to handle an influx of, should we say, queries coming in from the general public? Do we have the capacity?
Thank you, Kirsch. Yeah, I think we do. I think we are able to manage incoming requests for detail. Yeah, and we ought to encourage that. So yeah, thank you. So Laura, I think if I'm reading the room correctly, I think that idea has been roundly rejected. We should be using local media to publicise our forthcoming Council of Governor meetings.
Yeah, I think Dermot's made a good point in the chat. And obviously, at the moment, then they're not open to people to attend, but obviously we do upload the recordings on YouTube. So I'm not sure if at the moment if it's something more around publicising the fact that the meeting is available to view on YouTube, and publicising that more widely than we have been doing. And then obviously, depending what happens in the future, if we are able to open to public attendance again, then we can look at advertising that in the media.
Yeah. Okay. So I think you're asked not to amend that section. What number was that again? I was just looking for it again. 3.21.
3.2.1.
3.2.1 shall be communicated to local media. So you're asked to leave that in then, Laura, on the basis that even though we can't invite members of the public to join us. It does at least inform them the meeting's taking place, and as Kirst points out, it offers the potential for members of the public to submit questions or details. So we're asked to leave that in, please. Okay. Otherwise, we are being asked to approve, please, the amended standing orders. Are we content to do that?
I think, Jackie, did you want to come in?
No, I was just looking for my notes because I did gather some just on terms of how many views we'd had to the board that has been uploaded, the board recordings that have been uploaded, and the Council of Governors meetings that have been uploaded. And there have been quite a few, I think, well, less for Council of Governors, probably around 30 to 40, and then 100 plus for the most recent board recordings. And I think what we've done is we published that information in Global. We've published it in the recent membership update that went out following the Council of Governors meeting. I think you're absolutely right. There is an appetite for information. I'm not sure as yet how long people actually stayed on there, what they were watching, what they were listening to. So I'm just seeking that information from our communications team at the moment in terms of Google Analytics. And so I'm hoping to have something that's a bit more, kind of comprehensive to share with you, kind of at the next meeting. But I think so in some senses, I understand exactly what you're saying, Kirsch. If people don't know, then they don't know. But I think press releases are just one of the ways in which we can tell people about things. There are hundreds of other ways we can start using. And I think here, the Trust can do what it does, but also it's the governors using their networks and contacts and also sharing that information and passing it on, so it becomes a kind of relay. So I think there's something that we can pull together, and I'll have more information about, kind of what people have been looking at in terms of the recordings next time we meet.
Thank you, Jackie. Thanks for that additional information. Look, the governors are clear. The standing orders state that the meetings shall be communicated to the local media, and so that will not be removed, and we will continue to do that. Okay, that's what we've heard. In light of that, have governors had the chance to look at the other proposed amendments, and are we happy to endorse and support those that revised standing orders? They're reviewed annually, of course. So, yeah. Again, I'm just going to make sure and refresh and make sure there's no hands up. I think we have, and I think without dissent as well. And we pick up on the point on 3.2.1 that stays. Okay. Thanks, everybody. We'll move to item 14. Wendy, would you like to talk to the Governor's Nomination and Remuneration Committee report, please?
Yes, thank you, Max. The report, I'll take the report as read, because basically virtually all of the items on it are being raised in other parts of the agenda. Apart from the NRC annual review, we're doing an annual review, which the results of which will come to the next meeting. I don't think I can add any more to that, really.
No, that's great. We're being asked to note the report, Wendy. Thank you. Are there any questions that arise from the NRC report, please, from governors who are perhaps not part of that committee? And I should take that opportunity perhaps to say that I'm sure governors will want to join me in thanking Selina Uller for her service, because this would have been Selina's last Council of Governors meeting, but sadly she's been unable to make today's meeting. But after 6 years, she's obviously spent a long time with, I guess some of you governors have built up a working relationship with Selina longer than myself. And so we thank Selina, and we note her contribution to Council of Governors. Yeah, and look forward to appointing a replacement, of course. Consent to note? Yeah, happy to do that. Thanks, everybody. And we'll move to item 15, which is the appraisal process for the coming year for myself and our non-exec directors. Laura.
Thank you. So the appraisal processes for the chair and the non-executive directors are required to be reviewed and approved by the council on an annual basis. So the processes have been reviewed and there are a couple of proposed amendments. So we're proposing that a documented personal development plan is included within both processes. And I think this was raised by our Director of HR because it supports the evidence required for the fit and proper person test. We've also made some amendments to reflect the requirements of the NHS England and Improvement Chair Appraisal Framework, which means that the appraisals will be carried out during the first quarter of the financial year. Because we're required to send a copy of the Chair's appraisal to NHS England by the end of the first quarter. The Chair appraisal process also includes a requirement to seek feedback from the NHS England and Improvement Regional Director, so that's in line with the national framework. These proposed amendments were reviewed by the Governor's Nomination and Remuneration Committee on the 9th of March, and they agreed that they should be presented to the Council for approval. Yeah, and the full processes are attached to the appendices. Thanks very much, Laura. So again, colleagues have been asked to approve the Chair and NED appraisal process for 2021. Are there any questions or clarifications that are needed, please? I'll put that to Governors. Are you content to approve the Chair and NED appraisal process? Yeah, it's looking like that, and I see no note of dissent or comment, and so we do that. Thanks very much, everybody. And then we move to item 16, which is a small amendment to the appointment process, in which the Chair previously could ride roughshod over the thoughts of the NRC, and somebody's picked that up on the NRC and said, we really ought to change that, Max, and so hence this change here. So Laura, would you like to describe what that proposed amendment is, please? Yes, so the process as it previously stood meant that if the chair or senior independent director didn't support the reappointment of a non-executive or the chair, then an open appointments process was instigated. So the Nomination and Remuneration Committee queried why there wouldn't be any discussion at the committee in those circumstances, because the committee might disagree with the view of the chair or the SID, and they might want to recommend that a reappointment is made. So I think following quite a lengthy discussion where we tried to work out what the appropriate thing would be to do, I think we came to the conclusion that all recommendations regarding the reappointment of either a non-executive or the chair would be referred to the Nomination and Remuneration Committee and then to the Council of Governors for a final decision, and that would be regardless of whether the chair and the senior independent director and the Nomination and Remuneration Committee were in agreement or not. So in any case, the final decision would be made by the full council. So we've made amendments to the process to reflect that, and that's attached Appendix 1. So we're just asking council to approve those changes. Thanks very much, Laura. So to be fair, it is a fair shift that from the authority of the chair to the NRC as a whole body and to the Council of Governors as a whole body. So yeah, again, are we content to approve the proposed amendment to the Chair NED and Associate NED appointment process outlined in that Appendix 1? Everybody okay with that? Yeah, again, I don't see any notes of additional detail needed or anything, so we're content to do that. Mark, I think you're with us now. It's good to have you with us. I realise you're having a technical problem, so thank you for your note to me. And we do indeed approve that amendment. Thanks, everybody. I'll ask whether there is any other particular business. There are reports from the board attached from our Regulation Assurance Committee, our Audit and Assurance Committee and Charitable Funds Committee, some of which certainly were viewed by governors as observers. But I'll open up now just to see whether anybody has any other particular business they wish to raise. And if we're content, having got through the agenda that we've managed what we need to do, I'll just invite any comments or thoughts as a review of the meeting. So I think we've tried here, as you've seen, to give you wider access to information. I tried to make sure that the requests from previous discussions were brought forward into this.
wider input. You've heard a bit more from other exec colleagues who are all, of course, working to Mel in different portfolios, and heard a little about the academy business and the opportunity to question the chairs of each of the academies in relation to any aspects of the academy work that's happening. So I would propose that as a fairly positive change. There was quite a lot of transactional stuff to do, of course, but we've managed, I think, to get through that. From my perspective, I maybe haven't heard as much from governors in the Council of Governors as I might have expected, but it may be that the pre-meetings do help to give you further detail. Shall I open up and ask whether anybody would wish to make any comments in terms of a review of today's meeting, please? I'm going to take that as a sign people are content. Either that or my computer's still not working with people's hands. So, no, I see no hands raised. I think people are content with the detail provided. Okay, that's fabulous. Thank you very much, everybody. We meet again as a Council of Governors on Thursday, the 15th of July. But we obviously look forward to maintaining our working relationship with governors, and we know from today's meeting, of course, we'll be convening 1 or 2 special sessions. I do want to express my appreciation to the directors for the strong attendance at this meeting. It's very important that the governors get to see you and hear from you, and so I'm grateful again to such a strong attendance at this meeting. We're going to move into a closed session of governors, so I'll be closing this meeting down in a minute. I propose that we do still start that at 5:30, please. Let's give people a chance to have a leg stretch and a cup of whatever's needed. Directors, exec directors, non-exec directors are, of course, excused from that closed Council of Governors. But governors, I have asked if John Holden, our director, our Deputy Chief Executive Officer, would just join us for the first 5 minutes or so of that matter to brief us on an item. So, John, am I safe in doing that? Are you available to join at 5:30? That's great. Thanks very much for the thumbs up. That's good. Yep. So we'll start with a quick item from John at 5:30, and then deal obviously with the closed items. So again, thanks very much to everybody for your energy and contribution and commitment. And you know, we keep moving forward, and we seek to get to outstanding by picking on areas of our business where we're nearly there, and really promoting those through assurance learning and improvement. So thanks very much, everybody. We note the chat comments as well. They will be recorded and used to advise the minutes where necessary.
So, Max, can I just quickly ask?
You can.
It's probably my error, but I can't see the papers for the coming meeting. Is it in an email or something?
It should have been. I'll turn to Laura or to Jackie. Yeah, they should have.
Yeah, Sheridan emailed them out.
From Sheridan. Sorry, I probably just didn't gather them like I gathered them.
Yeah, they came out a bit earlier than the open papers, I think.
Okay. Thanks.
Yeah, I didn't receive mine. I had to email Sheridan again today because it was not visible in my email, even though she indicated that she sent it.
Okay, right. Well, we'll pick up on that and note that, and I'll make sure at the meeting there's time just to make sure people have got access to the papers and at least understand what the papers are about. So, yeah, thanks everybody for that. And again, directors, thank you very much for your attendance and contribution. Good Council of Governors meeting. So I'll close that now, and we'll rejoin as governors only, but with John at 5:30. Okay. So thanks everybody, and take care. Come on, let's have a wave. Those of you that are not waving, Dermot, come on, I want to see you waving. Thank you very much. Come on. Mel, that's a right picture. Have you got your phone out now? That's a great picture. Maybe not. Another time, eh? Are you doing it? Come on, we'll do it. Come on, let's get waving. We're happy governors. Come on.
Great exercise as well.
Great stuff. Does anybody object to that going on Twitter?
Have you been watching?
I didn't hear